Welcome to today's video where we're going to do a little bit of breathing work, pelvic tilting, as well as some hip folds and some mobilizing and release for our low thoracic spine. We'll need a pillow for our head and a balance cushion that's fairly cushy for a little later in the class. So I'm going to set that aside for now, and we'll come to lie in our hook lying position, knees bent, feet flat. And take a few moments here on the floor and see if we can get as easy as our bodies will allow, laying on the mat, eyes closed, feeling for the connection of your feet into the floor, the connection of your back of pelvis or sacrum into the floor. Feeling the connection through your mid-back, maybe some of your shoulder blades, as well as the back of the head. And as you're inviting any unnecessary tension to melt away or melt out of your tissues, with your mouth softly closed, the tongue resting on the roof of the mouth, begin nasal breathing and perhaps saying to yourself, air in and air out as you inhale and exhale. And as you continue to breathe softly, notice the contact between your lower thoracic spine, sort of the last 3 or 4 ribs, and the mat. And just see how much contact there is in that region. We don't want to press it into the ground or force it into the ground. However, through gentle nasal breathing and softening of our muscle tension, could we feel a little more contact in the back base ribs or low thoracic area? And then we're going to start moving our pelvis and our pelvic tilts. So finding those hip points and rocking those hip points towards your ribs and rocking those hip points away from your ribs. So slow and steady rocking hip points towards ribs and hip points away from ribs. When the hip points go towards the ribs, notice how that rolls the pelvis back. When the hip points move away from the ribs, notice that that rolls the pelvis forward. So you can think about rolling the pelvis forward and back. And sometimes once you've become really familiar with one cue, you can start playing with different cueing. And you'll realize that when you roll the pelvis back, the low back flattens. When you roll the pelvis forward, the low back arches. You might also notice that it's more than just the low back moving. And since that focus today is that lower thoracic, maybe even as specific as the 12th thoracic vertebra, you'll notice when the pelvis rolls back, the low thoracic sinks to the floor. When the pelvis rolls forward, that low thoracic lifts away from the floor. Pelvis back, low thoracic sinks, pelvis forward, low thoracic lifts. So just see if you can tap into that lower thoracic area. And then notice how much are you using butt squeezing to accomplish these pelvic tilts. And
could you perhaps use a little less or a lot less? So we'll pause from our pelvic tilts, and we're going to imagine our glutes, our semi-spherical glutes, as two sponges. And you're going to squeeze those sponges like you're squeezing water out of a sponge. And then you're going to slowly reverse the squeeze and let your glutes fill up with nice, clean, hydrating water. So you're going to squeeze the glutes, and then you're going to reverse and let those glutes absorb some nice fresh water. So picturing those sponges, it's almost like we're squeezing the water out for a count of 3, and then we're letting the water absorb for a count of 3. So the volume is kind of turning up on our squeeze, 1, 2, 3, and then the volume is turning down, 3, 2, 1, no more tension. And then we gather up that tension, 1, 2, 3, and then we reverse it, 3, 2, 1. Do that a couple more times, maybe imagining the sponges, squeezing out the tension, and then allowing those glutes to be full, hydrated, and easy. Last time, squeeze, and reverse. We go back to our pelvic tilting, rocking those hip points towards our ribs and away, and just seeing if we have less tension in our glutes than previously. So sometimes bringing our awareness to sensation allows us to adapt or change that sensation. We're going to check in that our breathing pattern is an inhale to roll the pelvis forward and an exhale to roll the pelvis backwards. An inhale to roll the pelvis forwards, and exhale to roll the pelvis backwards. That low thoracic lifting when we roll the pelvis forwards, that low thoracic flattening when we roll the pelvis backwards. Okay, time to incorporate our sit fit. So grab your sit fit, balance cushion, slide it under the pelvis. Your sacrum is fully supported, that triangular bone at the back of the pelvis, under that sit fit. And you want to make sure that behind the belly button, there isn't any sit fit. So it might feel like your pelvis is a little more to the top of the sit fit than centered. That's okay. And you're going to go back to those pelvic tilts, rolling the pelvis back, and really feel low thoracic drop like a hammock, and rock the pelvis forward. So roll that pelvis back and really drop the low thoracic like a hammock. And you're doing this with very little butt squeeze. You're exhaling to roll the pelvis back and inhaling to roll the pelvis forward. Using that exhale to help assist the pelvis rolling back. Using that inhale to help assist rolling the pelvis forward. And minimal effort here. This isn't a big, heavy task. We're just letting the pelvis roll and the low thoracic responds. We're going to roll that pelvis back and hold it in a rolled back shape or rolled back position. Gentle through the glutes, so minimal squeezing if any. Tie those imaginary puppet strings to your hip points, and you're going to lift one hip point to the ceiling and then lift the other hip point to the ceiling. So we are rotating the pelvis And you're also rotating through that low thoracic area. You could even ask yourself, am I feeling like that low thoracic area is turning? Are those vertebrae rotating? Hopefully, yes. You can have your hands for a brief moment on either side of your pelvis. And we're not knocking into those hands very much. Just one hip point goes skyward, while the other hip point goes away from sky. See if you can hammock that low thoracic, inviting it to get softer, quieter. And really, we're lengthening the spine muscles in that area while we maintain this rolled back pelvis. And we're also introducing rotation, which is often a movement pattern that we use less and less over time, and it can be really helpful to reintroduce. And then you'll pause and you'll come off that sit fit, lay the pelvis down, go back to those pelvic tilts from the very beginning, and notice, do I feel more contact through my back base ribs? Do I somehow feel a sense of more groundedness, more ease in the body? And then we'll pause and we'll end with a little core stability work here. So we're going to keep our pelvis relatively still, pubic bones and hip points on roughly the same horizontal plane. And we're going to pull one leg into a hip fold or a tabletop position. And we'll exhale as you set that leg down. So inhale, pulling one leg into hip fold. Exhale, and set that leg down. From here, we're trying to keep the back of the pelvis connected to the floor. Minimal shifting side to side. And we're also attempting to keep the space between the low back and the floor fairly consistent. So a neutral pelvis and these alternating hip folds or alternating tabletop. Inhaling as we bring the leg up and exhaling to come down. Hopefully you're feeling some connection in that core. In particular, as you set the leg down and use that exhale, it can even be audible, to keep the pelvis neutral. One more each side. And that is where we will end for today. You can come on up and have a walk and see if that pelvis stability, low thoracic softening, and a little bit of core integration, core stability helps you move about your day. Thank you.